Welcome to another episode of the Erectile Dysfunction Radio Podcast. Today we are joined by Dr. Richard Natale. Dr. Natale is a board-certified urologist practicing in North Carolina at Carolina Urology Partners. He completed a urology residency in 2009 at the University of Florida. Dr. Natale has specific interest in treating men's health concerns, including erectile dysfunction, low testosterone, and Peyronie's disease, among other urologic conditions. Dr. Natale, thank you very much for joining us.
Well, Mark, thank you for having me. Appreciate the opportunity.
So what we want to explore in today's episode is the role of prosthetics in sexual health and in urology more broadly. One of the things that we have found is that health issues relating to genitals, even when they do not have a direct physical impact on sexual function, can be psychologically impactful, leading to erectile dysfunction, ejaculatory disorders, and whatnot. So prosthetics can be a solution for a number of these conditions, and we hope to learn more about that today. So to get things started, Dr. Natale, can you tell us a little bit about your practice?
Sure. So I'm a general urologist in terms of background and original training, taking care of all kind of gamut of diseases, urologic diseases, but I've focused in on the area of men's health over the last decade of my practice. So that kind of comprises a catch net of erectile dysfunction issues, as you're making mention earlier before, Peyronie's disease, and as well as things like prostate enlargement, urinary issues that may come with it. Now, in the terms of the specific area of erectile dysfunction, specialist or someone who has the focus and interest that, as I do, will walk people through the whole treatment paradigm and try to evaluate them in a very comprehensive, wholesome way, moving from, just counseling and discussion all the way up to and through surgery. So that's the summary of my practice in a nutshell.
I'm assuming that you are in clinical practice full-time. Is that correct?
Full-time, I'm also the president of my group. So I do have some administrative responsibilities, a couple of days a month that I take off and work helping guide our practice, but otherwise full-time urologist.
Seeing patients.
Yeah.
Okay. So Dr. Natalia, can you tell myself and our listeners, what is this word prosthetic, prosthesis? What exactly does this mean? And we can take it from there to get some of the applications to practical medical concerns.
Sure. The bottom line with prosthetic urology or prostheses and prosthetics in this arena is a surgical device that is implanted to help achieve an erection. And those typically folks who failed other medical therapies beforehand. So we think about the penile prosthesis as the mainstay of this. But the other part of prosthetic urology exists is in the function of urinary incontinence and issues related to post-cancer surgery side effects. So the prosthetic urologist is someone who engages in the treatment of ED with surgical implants, but also incontinence with surgical implants as well.
What constitutes a prosthetic when it comes to
prosthetic? So a prosthetic being the actual physical device that, like the different types of prosthetics that would be implanted include a rod-like device for erections. There's a two-piece device, which is partially pumped. And then there's a three-piece device, which is the most commonly implanted implant that essentially mimics as best as possible the erectile function that we have normally, with a hydraulic pump that draws fluid from a reservoir and puts it into the cylinders of the penis to get you an erection.
Got it. Okay. Now, when it comes to the treatment of erectile dysfunction, what exactly is the role of the prosthetic? Does this create an erection? Does it help to assist an erection? What exactly does it do?
It creates the erection. So in men who've had, whatever the causes are, and of which there are many, but men who are refractory to medical treatment, so the standard Viagra, Cialis, and all the rest, those guys then may move on to this surgical implant to help them actually achieve the erection.
Okay. Now, what is the surgery process of getting a prosthetic, I guess, from its packaging into the penis?
Well, the process itself is usually an under 1 hour minimally invasive surgical procedure where we make incisions either just above the penis or right below the penis, depending on patients' different parameters. We're able to insert the prosthetic device through those incisions, including the reservoir, the pocket of fluid that helps get the pump activated. We're able to do through one single incision most often. The surgery is about an hour. Usually you either go home the same day or you may stay overnight, go home the next day.
Once the device is in, does it require maintenance? Does this have to, do men have to come back in for tune-ups? Does it need replacement parts? Or is this like a one and done type of surgery?
Yeah. Well, the maintenance of it and the success and reliability of the implant, the mechanical reliability is excellent. And it really has been so over the last 20 years plus. And it's just been improved upon over time so that your likelihood of having a failure of a device is less than 1%. With that being said, the more repetitive use over time will eventually compromise its function, and eventually it may need to be replaced. Unfortunately, there is no way to maintain it in the terms of, almost putting grease to a squeaky part. Can't do that. So if there's anything that does break, it does require surgical revision. But the lifespan of the implant can be as long as 15 to 20 years, which I've taken care of a number of patients who've had implants for that long or longer.
Okay. And I assume that at the 15 to 20 year mark, the device would have to be replaced at that point just because it's no longer effective.
Honestly, I know as long as the implant's doing what it's supposed to do in getting the erection, it only needs to be replaced if it stops working. So usually I've been surprised. I had probably the longest implant I've seen in a patient was 23 years he'd had it. So that was fantastic. And it still worked.
Got it. So in other words, there's high mechanical integrity to these devices that it could go for quite some time, but I assume there's no warranty for the lifespan.
Yeah.
In other words,
exactly right.
There is a limited warranty in terms of what medicine or medical devices could guarantee, but some men have very long runs with a device before it would need to be replaced.
Precisely correct. Yes.
Okay. Now, if a man decides that a prosthetic is a good option, he's not having reliable erections, causing a lot of distress, and he wants to go ahead with this procedure, can he decide 3 or 4 years down the line that he now wants to go ahead and reverse this?
That's the tough part about the procedure. The answer is no. Once you've made the commitment towards putting an implant in, that is going to be the way you're going to get erections moving forward. There are some exceptions. Occasionally, men will able to achieve erection with a vacuum assist device, the kind of the penis pumps that you hear about more commonly may work on getting a man an erection if they were to have the device removed. But most often, this is a commitment of this is the way we're going to do it from now on. Okay,
so this is a big life decision. Now, from what I have understood about these devices, that once they are in, there's a very high rate of satisfaction among people who are using them. Has that been your experience as well?
Yes, absolutely. I sort of try to coin a phrase, and I'm trying to think of other R words, but I start off with the 3 R's: reproducibility, reliability, and rigidity. The other ones are spontaneity and durability. What I mean by all that is you get what you need when you need it for as long as you need it, as rigid as you need it, and can do so with very little planning. So that's the advantage of the penile implants that you can take to the arena of the lovemaking process afterwards, right? So you don't have to be the guy who runs over to the refrigerator and gets his shot or has to wait for his pill to work.
In other words, a couple pumps and this is done. But to that end, can you describe to the listeners how is a penile prosthesis used for gaining an erection?
Okay, so the prosthesis, the 3 parts, as we kind of made mention of earlier, those the implantable parts in the penis. The cylinders, imagine just kind of condensed, flattened for lack of a better description, balloons that fill with saline, and those are inserted in the erectile bodies of the penis itself. So the pump, which is a manual pump in the scrotal skin, underneath the scrotal skin, is pumped by the patient, drawing fluid into those cylinders until they've reached such a maximum rigidity that now you have achieved the erection. And it mimics the body's natural process of getting an erection by filling those erectile chambers. Now, instead with blood, now you're doing it with a saline pump.
Okay, so again, a man pumps this, pump which is located, he said, behind the scrotum.
Actually, it's right in the front and the lower part of the scrotum, typically.
Front, lower part of the scrotum.
You got it.
And that fills the chambers with saline, which creates until the desired rigidity.
Mm-hmm.
He engages in a sexual activity, and then what?
So once, and this is the joke I kind of tell with my patients, going back to that durability issue about how long it lasts. So a man can climax and will remain erect afterwards until you turn off the device. So I joke because you're kind of like the Superman, right? You can, if you do climax too soon, or not your partner hasn't reached that point yet, your erection will not go away until you tell it to. So with the pump that has an off button to it, so it'll stay erect throughout the entire intercourse act.
And how does that off button work?
So this is a hydraulic pump. So as soon as you hit that off button, what you're doing is releasing the fluid back from the cylinders. And usually what you're trying to establish when you hit the off button is you're opening up the valve that exists in between the pump itself and the cylinders, allowing the fluid to kind of pulse back into the reservoir. But typically what we wind up doing is you'll hold the button for a few seconds, release it, and then squeeze the penis to drain the rest of the fluid out.
Okay. And then I guess the penis returns at that point to being flaccid.
Yes.
And
yes.
Is there a refractory period that the device has to then rest, or could it be repumped without needing any break in between?
You could repump it without needing the break.
Okay. And because it works as a hydraulic and with a pump, is it the number of pumps that are used over the lifespan that generally indicate how long the device is going to last? So I'm sure there's some men who use it pretty frequently and other men who use it on occasion.
Yes.
Does that make a difference?
That exactly right. So a couple of things in terms of the pumping. First of all, the number of pumps that are cycled actually depends on the size of your penis. So the larger the penis, obviously, the more you're going to have to pump the device to get enough filled into the chambers to get the erection. The more you manipulate the pump and squeeze it over time, whether it's the number of pumps itself or just the actual action of pulling in on the tubing, eventually will lead to compromise of that tubing, which would make the device no longer work. Therefore, theoretically speaking, the more often you're using it, the greater the likelihood that it will break sooner than the guys who don't use it very frequently.
Okay, which makes a lot of sense. Now, you mentioned something that caught my ear, which is the number of pumps is going to correlate to the size of the penis. Does that mean that a prosthetic is custom made or custom designed for each penis, depending on its size and its girth? Or is there like a one size fits all, inflate until there's no more space?
Yeah, that's a great question. So the answer is it is relatively customized to your penile length. And what I mean by that is that the device is made up of two parts. The actual cylinders that get erect in the penis, there's the cylinder itself that fills, and then something called a rear tip. And what happens is, depending on the particular measurements of the man's penis, we will change the length of the cylinder and or the length of the rear tip, the backside of it, to fit the penis in such a manner where you get the best rigidity possible out of the implant. So it is custom to the patient's overall measurements. We just don't put a one size fits all, because not one size does fit all.
Got it. So, Dr. Natale, who is a candidate for a penile prosthetic? Because I think our listeners are well aware that medications like Viagra, Cialis, obviously their generics, are well consumed in the general male population, really ranging in all ages. When it comes to these other treatments, these other interventions, I think it becomes a little bit more confusing as to who really is an appropriate candidate or a right candidate for the prosthesis. So if you could let our listeners know who fits the bill or who could potentially be a good fit for a prosthetic.
Sure. I have a tendency, and I might be a little bit long-winded in this particular response, but I do so because I feel so passionate about treating erectile dysfunction, in particular with the idea of prosthetics as necessary. To me, I usually define the need for this surgical intervention based upon a patient's sexuality and sexual needs first. So I kind of flip the paradigm to some degree. Yes, I will ask patients to march through some of the steps. I certainly don't want to put a prosthetic in someone who's never tried Viagra. But with that being said, the first assessment is, well, tell me a little bit more about your sexuality. Are you making love, or were you making love 3 times a week, 2 times a day, or was it a once in every 6 months idea? That then guides me as to what the patient may need. So if I go from there to the next thing is, well, what have you failed? What's worked? If they haven't tried anything, always, it's medications. But as we get patients who are pushing the envelope, they're not doing well with the medications, maybe they're even doubling them up at times, then the next step beyond that is the discussion of, okay, here are the remaining treatment options. Do we need to just consider a prosthetic implant because you make love often? Or do you want to try perhaps a less invasive option because we don't, you may only make love twice a year. So I understanding the patient's needs in the bedroom for me then helps me walk them through that journey to apply whatever therapy is appropriate.
And I really, really appreciate that answer, because I think in particular, when it comes to sexual function, even that word itself is so much dependent on what is happening in a person's life and
Yes.
and what's happening in their relationships or in their sexual relationships. And being able to look at erectile dysfunction as a situational, as opposed to just an objective medical diagnosis, because anybody who's struggling with erections, one could make the argument, could be a candidate for an implant.
That's
but
right.
It really depends on what's going on in their life as to whether this really is a good option for them. If they're not overly sexually active and don't plan on being, maybe this isn't exactly the treatment that would make the most sense for them. Whereas somebody who is very sexually active and is deeply distressed by not having a reliable erection, this could be a really great alternative. They may have the same medical profile,
Yes.
but their lifestyle may send them down different treatment roads.
Yeah, 100%. It's about, it's if you are, I hate to say this in this way, sounds like I'm boasting, but if you're good at your job, you're going to look at the patient as a person. And maybe this is wrong of me to say, but I sometimes will put myself in their shoes and try to understand from their perspective. Because if everything is a nail because I'm a hammer, I'm not doing my job right. Really, truly, I don't want to put everybody into that kind of round square peg and a round hole type stuff. I think you need to really customize to the patient's needs first. And that's listening, that's understanding, their journey, what their needs are. It's just key.
And we talk a lot on this podcast about the nuance and the individuality to erectile dysfunction. And I always appreciate when the medical counterparts to the psychological side of erectile dysfunction also can see the patient in that way. So I have deep appreciation for how you approach that. Now, how many men who are potentially good candidates go through with this treatment? It does sound a little bit invasive, and I know that many men do get a little bit squeamish when it comes to injections and surgery and whatnot around the penis.
Yeah. There's global statistics that we hear very frequently quoted is if you apply the definition of ED being anything from, I'm not able to get it as hard as I used to, all the way up to I can't get it anything at all. There's probably 30 million men in the United States who have this trouble. And to put that in perspective, out of the 30 million, obviously tens of millions are getting prescriptions for the medications. There are only about 15 to 20,000 implants put in per year. And you got to figure that some of those implants are patients that have had device revisions over the lifetime. So you're talking about a tiny fraction of people who will make that next step. Now, I think a lot of it has to do with something else that we sort of discussed, which is this kind of idea that sexuality is not something we need to share with our physician in a medical discussion. And so people don't seek out that care. So that we get a lot of the old joke about, hey, I had my hand on the door handle about to walk out. Hey, can I get a script for Viagra? I think because of that, people aren't getting the exposure to this as they need to be. Because then there's one last piece of data to share, which is the average time it takes a patient who is a candidate for an implant to actually go to implant is about 7 years. So these are guys who've been sitting there struggling silently. They're miserable, waiting, and then they're finally going into this stuff. So I can tell you that while there's 15,000+ implants being put in per year, I can tell you there's probably hundreds, potentially of thousands of men who probably should get an implant.
Yeah, we certainly don't doubt that, because I think it's something which is across the board when it comes to probably medical care, but certainly when it comes to sexual health. And I see the same thing in my practice with just coming to talk to somebody about this. So I hear, rather often that, I've been sitting with your card for a year, and I look at it every day, but I just couldn't bring myself to call until it got, to a point where it's so challenging. I picked up the phone. So I certainly hear that. But what I'm gathering from you is that it is really a fraction of the men who probably could benefit from an intervention like this that actually are following through.
Yes.
With the procedure.
100%.
We've spoken a lot about the use of the prosthetic when it comes to erectile dysfunction, which I understand is its primary use. But could you educate both myself and the listeners about what are some of the other medical uses for a prosthetic? What conditions are they used to treat?
Well, I'm going to start off first with what it's not. And I tell you that because there are some men who will come, and this is actually a very pertinent topic for both of us to talk about. There's men who come with almost a body dysmorphia of, my penis isn't normal. I need it to be bigger. I need it to be wider. I need to be different. The penile prosthesis is not like a breast implant. So it's not going to give you, I've always wanted a 10-inch penis. It can't do that. So it's 100% functional. There's not an aesthetic use for it at all. Now, with that being said, the use and application of the device outside of simply erectile dysfunction is the other use for the device is for the correction of a condition called Peyronie's disease. So men who've had severe curvature of the penis, in which either medical therapies have not worked, or the severity of such would be that any surgical treatment to correct the curvature would result in erectile dysfunction, we oftentimes will implant a penile prosthesis. Because the devices themselves, because the nature of how they work, the rigidity, they in and of themselves may correct the curvature, or at the very least allow for us to do more advanced surgical techniques to correct the curvature. Outside of that, I've had some men who honestly have penile prosthesis so they can gain access to their penis more easily. There are some men who, between the effects of medical issues, age, obesity, will have such a shortening of their penis that they just can't get to it. So by putting something that's somewhat rigid in there, or at least has stretches the space, they're actually able to kind of grab the penis and just do simple things like go pee. And
if I could just kind of pause you there for a moment. Now, I know that we spoke a little bit more about the inflatable prosthesis.
Yeah.
But in the situation where there's a shortening of the penis and it's hard to reach, would a more traditional prosthesis where like it's just from what I understand, like a tube, it could be bent and create more rigidity. Would that be like a more common or more appropriate?
Yes.
Okay.
Yeah, particularly if it's not, the rigid implants are difficult for sexual satisfaction just because of the nature of how they bend and move. Now, I'm not saying that they can't be used for that reason as well, but if we were looking typically for someone like what I just mentioned absolutely. In fact, ideally that patient would be a candidate for it also, because usually they're heavy set. And what comes with that is, other medical conditions such as diabetes and all the rest. So if we were going to do something simple and a little bit quicker of a surgery and and less risk of infection, that's an ideal circumstance.
Okay. Are there any other urological conditions where a penile prosthesis would be used to treat?
Not necessarily outside of those two things. So outside of erectile dysfunction and Peyronie's disease, the penile prosthesis itself for the purpose of erections, that's it. It was really the other prosthetic implants that I mentioned earlier about urinary continence.
Okay. And can you just kind of refresh our listeners' memory about the other types of prosthetics?
Sure. So occasionally when men, for example, who've had prostate removal for cancer, they'll develop a condition called stress urinary incontinence, and they'll leak with cough, laughing, sneezing. They may even just leak constantly after the surgery. There are two implantable devices. One is called a sling, the advanced male sling, which can reposition the urethra and allow for the better support and therefore more control, typically in the more mild to moderate leakage patients. And that, you hear the word sling, a lot of people get worried about the ugly words we heard about in the media a few years ago, but this is not that type of material, or at least type of device. The second is something which I find brilliant, is an artificial urinary sphincter, which is a cuff that wraps around the urethra channel out of the bladder and mimics our pelvic floor. And it's a really neat device because it's filled with saline. It keeps the urethra closed. The pump in this particular case is pressed once, draining the fluid out of the cuff and putting it into something called a pressure regulating balloon, which in and of itself wants to return back to its normal size and refill that cuff, resulting in a cycle in which you're closed, you press a pump, you open, you pee, and it slowly closes back on itself, mimicking our normal function.
So there are obviously other uses of prosthetics in urology outside of erectile dysfunction. When it comes to a penile implant, that seems to be really around erectile function and possibly correcting Peyronie's disease, which there's a fair amount of overlap between Peyronie's disease and erectile dysfunction.
Yes.
But these other prosthetics, though, are not for that purpose.
Yeah, that's correct. Yeah.
All right, Dr. Natalia, is there anything else that you want our listeners to know about prosthetics? Certainly, if there are listeners out there who maybe are on the fence or are curious about this, what would you want to message to them?
So to wrap that part of it up, I think that it's important to find the people who are going to focus on taking care of the patient first, right? So having a good interaction with your physician, understanding kind of their philosophy is how they take care of patients. That's number one. Number two is making sure that that doctor also does a fair volume, because you can reduce the risk of complication and improve the likelihood of a good outcome with a surgeon who does more than a few a year. And that, we know that to be the case through all types of specialties. So having someone who's more focused on that is very important. From there, it's also just about doing your homework of the device. It's easy to Google search something and find the negative things like we can do for everything in the world, but understanding the positives, understanding how it fits in your life, taking that time is important. And finally, I really encourage all my patients to come with their partners. Not involving your partner is a mistake, because that's not any other reason, but you want to have a supportive environment in which we're collaborating together on how to fix this problem, obviously with the person you're making love with. So those are the kind of key things I think are important for my patients that I hope that they all think about, or anybody who's listening to the podcast, I would suggest that to them as well.
Okay. Well, Dr. Natale, thank you very much for joining us. This is going to be very informative to our listeners out there, and I can't wait to get this episode out.
Awesome. Thank you.